Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Tailbone fracture. Introduction. A fracture happens when a bone in the body breaks. Tailbone fractures affect the tailbone. The tailbone is the small bone at the bottom of your spine. Tailbone fractures cause pain in the tailbone area. The pain may make it difficult to sit and do normal activities. This program explains tailbone fractures. It covers causes and symptoms of a tailbone fracture. It also covers how a tailbone fracture is diagnosed and treated. The tailbone. The spine protects the spinal cord and the nerves that go to different parts of the body. The spine is formed of solid vertebrae. The vertebrae are separated by softer discs. The tailbone is a triangular bone at the bottom of the backbone or spine. The tailbone is also called the coccyx. It is made up of 3 to 5 small bones. These bones are fused together. Causes. A tailbone fracture is most commonly caused by trauma to the tailbone area. Tailbone fractures often happen when a person hits their tailbone against a hard surface. This can happen when a person falls down and lands on their tailbone. A direct blow to the tailbone area may also cause a fracture. This may happen in some contact sports. Hockey and football are examples of contact sports. In some cases, the tailbone may be injured or fractured during childbirth. As the baby is born, the pressure may cause the tailbone to break. The tailbone can also be injured from repeated straining or friction. This can happen in some sports such as bicycling or rowing. Rarely, a tailbone fracture may be caused by bone spurs, which are abnormal growths of bone, infections near the tailbone, injuries to other parts of the spine, tumors. Sometimes the cause of a tailbone fracture is unknown. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Symptoms. The main symptom of a tailbone fracture is pain in the tailbone area. The pain may be severe. It is generally worse when sitting or if direct pressure is applied to the tailbone area. Other common symptoms of a tailbone fracture are bruising near the tailbone, pain during bowel movements, redness and swelling near the tailbone. Women with a tailbone fracture may also have pain during sexual intercourse. Talk to your healthcare provider if you notice any of these symptoms or other changes. Finding a problem early usually makes treatment easier. Diagnosis. Your healthcare provider will first ask about your symptoms and medical history. You may also be asked if you have fallen or had any other trauma recently. A physical exam will be performed. During the exam, your healthcare provider will check the tailbone area for swelling, bruising, and tenderness. He or she may also examine the rest of the spine. A neurological exam may be done. This exam checks your body's reflexes and responses to see if your nervous system is working correctly. In some cases, a rectal exam may be done. During a rectal exam, a healthcare provider inserts a finger into the rectum to feel the area of the tailbone. This exam can help determine if the tailbone has been fractured. X-rays may be taken to determine whether there is a fracture, but in some cases an X-ray may not reveal this type of tailbone injury. X-rays sometimes may be taken while you are in both standing and seated positions to help find any fractures. Rarely, if the cause of tailbone pain is unknown, a local anesthetic may be injected into the tailbone area. This can help determine if the pain is from the tailbone or another part of the spine. Treatment. Treatment for a tailbone fracture involves managing pain while the bone heals. This type of fracture can heal slowly and may take up to 8 weeks to heal. It is hard to prevent the tailbone from moving while it heals. Your healthcare provider may recommend that you stay in bed for a few days. You may also be told to move only in ways that do not cause pain. You may be given medications to help manage pain while the bone heals. Some pain medications are injected directly into the tailbone area. Straining during bowel movements may make your pain worse. You can use stool softeners to help prevent straining while your tailbone heals. Other ways to prevent constipation include drinking lots of fluids, eating fruits and vegetables, eating whole grains and foods rich in fiber. A tailbone fracture can make it hard to sit without pain. To help manage pain while you sit, you can alternate between sitting on one side of the buttock or the other. Massage the tailbone area in a circular motion using an ice pack. Sitting on an air cushion or a donut-shaped pillow. You can also try sitz baths, which involve soaking the anal area in warm water for 10 to 20 minutes. Slouching to move your weight forward and off the tailbone. Sitting on a large book with the area of the tailbone hanging off of the book. Sitting on soft surfaces can also be painful because it may increase the pressure on the tailbone. Avoid sitting on soft surfaces while your tailbone heals. In some cases, a tailbone fracture may cause ongoing pain. Rarely, this pain may be treated with a surgery to remove the tailbone. This treatment may be an option if all other treatments fail. Prevention. Not all tailbone fractures can be prevented, but you can help lower your chances of getting a tailbone fracture. The best way to prevent a tailbone fracture is by avoiding trauma to the tailbone. You can do this by building strong muscles to prevent falls. Regular exercise can help you build strong muscles. If you play sports, always wear the proper padding and safety equipment. This can help prevent fractures. You may prevent yourself from falling by avoiding going out in icy weather when possible, cleaning up spills in slippery areas right away, installing handrails on both sides of stairways, removing tripping hazards such as loose cords and rugs from walking areas. You can prevent falls in the bathroom by installing grab bars next to the toilet and in the shower or tub, using non-slip mats in the bathtub and shower. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. A fracture happens when a bone in the body breaks. Tailbone fractures affect the tailbone. The tailbone is the small bone at the bottom of your spine. Tailbone fractures cause pain in the tailbone area. The pain may make it difficult to sit and do normal activities. Other common symptoms of a tailbone fracture are bruising near the tailbone, pain during bowel movements, redness and swelling near the tailbone. Tailbone fractures often happen when a person hits their tailbone against a hard surface or when they sustain a direct blow to the tailbone area. In some cases, the tailbone may be injured or fractured during childbirth or from repeated straining or friction. Sometimes the cause of a tailbone fracture is unknown. Treatment for a tailbone fracture involves managing pain while the bone heals. This type of fracture can heal slowly and may take up to 8 weeks to heal. You may be given pain medications. Sitting on an air cushion or a donut-shaped pillow can also help. You can prevent a tailbone fracture by avoiding trauma to the tailbone area, taking steps to prevent falls, such as removing tripping hazards, wearing proper padding and safety equipment when playing sports. Thank you for using Explain.